the board and with all these great people to be on the board with. It's my distinct pleasure to make the final Jacqueline Kennedy Onassis Award presentation for 2010. The recipient's passion to help sick children across the world is unprecedented. His tireless efforts have provided hope to areas of the world that seem forgotten. Let's check out the video monitors to learn who this person is.
This year, the Jefferson Awards is also pleased to present a Jacqueline Kennedy Onassis Award for Outstanding Public Service benefiting local communities to Dr. Mark Kline. After visiting an overseas orphanage where underprivileged children with AIDS had been left to die, Dr. Kline returned home with a mission. He started the Baylor International Pediatric AIDS Initiative, and over the next decade treated some 30,000 HIV-infected children, more than double the number of HIV-infected children treated by every medical center in the US, Canada, and Western Europe combined. His passion for helping sick children also resulted in the opening of a new 21,000 square foot clinic in Uganda, making it the largest pediatric HIV/AIDS treatment center in the world. From providing comprehensive medical care to educating U.S. and foreign health professionals in clinical research in pediatric AIDS, Dr. Kline is making a difference in countless lives. The Jefferson Awards is proud to pay tribute to Dr. Mark Kline.
Representing KPRC TV in Houston, Texas, Dr. Mark Kline.
Well, this is an organization that knows how to keep a secret. I've been sitting down there next to Kim Davis from KPRC and did not have a clue. I feel so fortunate to have had the opportunity to work with HIV-positive children and families the world over. It really has been an incredible blessing to me. I have described the experience of seeing an HIV-positive child restored to health as being addictive. And once you have that experience, you want to have it over and over and over again. And I've been fortunate to work at two institutions, Baylor College of Medicine and Texas Children's Hospital, that have a passion for global communities of healthy children, and to work in Houston, Texas, where the community has been so supportive, and to work with a fabulous team of physicians and nurses and other health professionals. So all of the pieces were in place to make this happen. And I very much appreciate this award, which I will pass on to everyone who's been part of this effort over the past 15 years. Thank you very much.
So, kind of tell me your initial thoughts from the experience of being here.
Oh, it's an amazing gathering of service-oriented people from around the country. It's just been incredible to hear the stories, people, how they're serving their communities in various ways. Volunteerism is alive and well in America today, and I'm thrilled to be recognized, obviously, but really this is a recognition of the Houston community, which has been so incredibly supportive of our program, of Baylor College of Medicine and Texas Children's Hospital, two great institutions that are committed to healthy children, and to my team of doctors and nurses and social workers and other health professionals who really have done the lion's share of the work.
Now, I know that you people often recognize you for your work, but what does it mean to be honored in this way, and also to kind of be surprised with an additional honor?
Yeah, well, it's really special because, you know, I'm here with hundreds of people who share the same passion that I have, and so it's being recognized by peers, I think, is extra special. And the Jefferson Award is all about volunteerism and service, and I have a passion for the underserved and for providing service to people who need it, and so to be recognized amongst this group is particularly special.
It's at the back of the room. There's no pressure, but it's over there.
Another thing that we hear a lot now is about youth and kids, and a lot of the work you do obviously is with children, so that has to kind of also resonate with you.
Yeah, absolutely. You know, children have been on the outside looking in really for too long. They have not had the same access to services and to, in case of my particular interest, to medical care that their parents have had. And so my passion really has been around making sure that children achieve that same kind of access to care and treatment and for HIV/AIDS and for other serious diseases and life-threatening conditions. And my fondest hope is that children the world over one day will have the same access to life-saving care that American children and American adults have.